I'm Colin Mayfield.
And I'm Vanessa Rufus. Starting here with your health headlines, we know tomorrow the CDC's Advisory Committee on Immunization Practices is expected to meet, and this panel will likely talk about the COVID-19 vaccine and the recommendations on who can get vaccinated.
So just last week, the North Carolina governor and health department, they gave an order that allows people who are eligible to get the vaccine without a prescription. But people are asking, is that going to last?
WCNC Charlotte's Megan Bragg verifies.
Pharmacists in North Carolina follow guidance from the North Carolina Board of Pharmacy. Last week, the board followed orders from Governor Stein and NCDHHS, allowing pharmacists to give the COVID-19 shot to anyone 65 or older or anyone 18 and older with existing conditions without a prescription. But when new recommendations are released, what guidelines will NC pharmacists need to follow? Let's verify. Our sources, the North Carolina Board of Pharmacy, Greg Dees, pharmacist and owner of Oakhurst Pharmacy, and CVS. Both Dees and CVS tells us they are giving the COVID-19 vaccine to those who are eligible without a prescription. But when the ACIP meets, the board says they will take a look at those recommendations.
Really, at the bottom line, determines which vaccine, what ages, what are the indications.
The board also states many pharmacists have asked the board to waive the ACIP recommendation requirement. However, the board cannot do this because it's required by the Pharmacy Practice Act and would need a legislative amendment, not board action. So there are lots of moving parts to this. When the ACIP meets, we will know more about the guidelines and what pharmacists will be able to do when it comes to giving the COVID-19 shot. But until then, pharmacists in North Carolina are allowed to give the shot without a prescription if you qualify. With your Verify, I'm Megan Bragg.